guys, Dr. Andy here. Today I want to show you the Shockwave machine that we've just bought in the office. It's fantastic for tendon problems, tendinopathy. That's really common. Maybe plantar fasciitis, maybe the outside of the elbow for tennis elbow. But today I want to highlight and show you what we do for golfer's elbow, okay? So golfer's elbow is pain along the inside of the elbow right through here. Sometimes you'll actually feel some knots and maybe some muscle spasms right through the front of the forearm as well. And the reason for that is golfer's elbow is medial epicondylitis, and it's pain from repetitive wrist flexion. So anytime that you kind of flex your hand, palm goes in towards the face like that. If you put your hand along the front of the forearm, you'll actually feel those muscles contracting, and they all come to a central point right here on the inside of the elbow. So if you do a lot of like this for your work or something like that, you actually can develop what we call a repetitive stress injury. So a repetitive stress injury, it's a chronic problem. Essentially what's going on is that we have a lot of scar tissue and breaking down of the tissue of the tendon right through here, and we can develop a whole lot of muscle knots as well right through here. So what the Shockwave machine does is it gets in there and it breaks it all up. All of that scar tissue, it breaks it down. It's sending a bunch of really powerful sound waves into the body. That's what the Shockwave does. Breaks up all of that tissue. As a result, the body is able to create something new, okay? So breaks down the scar tissue, out with the old, in with the new. Stem cells come to this area and rebuild healthy tissue from scratch. It also helps with something called angiogenesis, which means that new blood vessels start to form, and then when we start to do it through the actual muscles, it can actually kind of melt some of those muscle knots as well. Okay, so all the things that's causing that kind of chronic elbow pain and forearm pain, it can really kind of melt it away. All right, so what we do is we start off with a little bit of ultrasound gel right to the tendon. Maybe we'll do a little bit into the muscle as well. So typically when you're going to do Shockwave, you're going to do it once a week. Treatment usually lasts around 10 minutes, maybe 15 minutes. Afterwards, because it can feel a little sore, you might want to avoid really heavy lifting or any kind of high intensity interval training. Think CrossFit maybe. But what we do is we find the sore spots and then we leave them there, and we let the Shockwave machine do its work, which is to get deep into that ligament, into that tendon, into the muscles, and just break up all of the injured tissue to clear it out so we can actually bring in some new healthy tissue, okay? So it sounds like that, makes that noise for a couple minutes, and then it's over. As I said, sometimes the treatment can be a little bit uncomfortable, not too bad, nothing that you can't handle, but then afterwards it feels a whole lot better. And helps us start regrowing and start the tissue regeneration process, okay? So this is an excellent treatment option for tendinopathy patients, especially something like golfer's elbow, that inside of that elbow pain, all right? Obviously, it's just from wrist extension. You don't have to be a golfer. You can still get that pain even if you're, you're a desk worker and type away at the computer as well, right? So if you have any questions, if you're worried about this is something that bothers you, send us an email, send us a message, ask away, and always remember to live with passion, not pain.